H3D is the holistic drug discovery and development center based at the University of Cape Town. Since its establishment in 2010, H3D has been on a mission to discover and develop new medicines for diseases that predominantly affect the African patient population. H3D has also been on a mission to develop tools and models that contribute to improving treatment outcomes in African patients. H3D has also been on a mission to develop new technologies that can be deployed in the process of discovering new medicines. Finally, but not least, H3D has been on a mission to train the next generation of African scientists who are skilled in modern, integrated, innovative pharmaceutical research and development.
So H3D is a multidisciplinary unit. 12 years ago when we were founded, we were mainly a medicinal chemistry focused lab up in the chemistry department at UCT. And of course, to do integrated drug discovery, you also need biology and you also need pharmacology. And because of that, we are now actually located across 3 sites at UCT. We've got our DMPK lab, which stands for Drug Metabolism and Pharmacokinetics. So at that site, we really test how drugs are metabolized. Then at the IDM on the medical campus at UCT, we've got our biology labs. And this includes TB biology, malaria, there's a parasitology lab, as well as an enzymology lab and an antimicrobial resistance laboratory. And then what we do is we take our small molecules from the chemistry lab and we subject them to the pathogen and we see which wells they're killed in and which ones they still survive in. And by doing that and testing your novel small molecule at different concentrations, you can tell how active it's going to be. So we also have a cytotoxicity lab, so we need to know how toxic our compounds are. And then all this data that our biology labs produce is then sent back to the chemists, and our chemists then use this to inform the design of their next round of chemical analogs. We also have a computer-aided drug discovery lab, and we also use machine learning and artificial intelligence models as well to help inform and accelerate our projects. So this whole being integrated across the 3 sites, having that design test make cycle where they get the information to inform what they make next, and we try to improve the projects, the properties of that compound. This is how we do drug discovery.
As a medicinal chemist, we have a crucial role in the early stages of drug discovery. We are responsible for designing, synthesizing, and purifying new compounds in order to optimize drug-like properties in a hope to identify a preclinical candidate. Typically, in a synthesis, we would weigh our reagents and set up our reaction for heating on a hot plate fitted with a fin denser if under reflux. While monitoring the reaction, we use an LCMS where we can detect the mass. Once complete, we will work up the reaction, rotovap off the excess solvents and isolate a crude product. The crude product can then be purified on a number of our automated purification systems that we have here at H3D. The final compound is then dried on the freeze dryer to isolate a pure dry product, which then we can submit to our biologists for testing against a certain bacteria or parasite.
Here at H3D, we use automated flash chromatography systems to handle the purification in our lab. For our flash system, we have the Combi Flash Next Gen 300 Plus system from Teledyne ISCO, and for our prep system, we have the AccuPrep HP150 system from Teledyne ISCO. This is a high pressure system, and this enables us to handle complex separations of mixtures.
This is the Combi Flash system, which we use here at H3D. It has drastically improved our purification systems for our final compounds. It reduces our time since we no longer have to manually pack our columns. The columns come pre-packed, and the software of this instrument is very user-friendly and often doesn't need to be monitored due to the UV absorbance aspect of it. And it allows us to continue with other work and then come back and isolate our pure fractions of our final compounds, which is the main game here as a medicinal chemist.
It's a very robust, portable machine, easy to use. In fact, I find it easy to learn, easy to train someone new to use. Method development is easy to set up. The automation system is fantastic. You don't need to sit all through for hours for multiple runs. You just queue one, get your method running, and then for multiple runs, you leave the machine to do its own thing. Come back after hours, get busy with something else, and pick your samples pure and clean.
So the equipment we have in the lab at the moment has allowed us to compete globally. The H3D Center has more than 30 global collaborations, both with academic groups in the US and in Europe, as well as international pharmaceutical companies as well. So in particular, things like the ISCO Teledyne automated chromatography systems, which remove the biggest bottleneck that we've got for chemists, which is purification of compounds, as well as things like our LCMS, which allows high throughput analysis of the samples that we're producing. So with equipment like that, to allow us to spend more time thinking and less time actually in the lab doing the hands-on work, we're able to really compete and contribute meaningfully to a lot of drug discovery projects.
So one of the critical success factors for H3D is networks of partnerships. We could not have done what we've done without partnerships, not just with the government of the Republic of South Africa, but also local industry, exemplified by Separations, who supply us with a variety of equipment that is so critical to the research and development that we do here at H3D.